Assisted reproductive technique refers to the medical procedure used to achieve the pregnancy in cases of the infertility. This technique involves the handling of eggs, sperm, or the embryos outside the body. Indications for are female infertility, tubal factor infertility, blocked or the damaged fallopian tubes, endometriosis, ovulatory disorder, PCOS, premature ovarian failure, unexplained infertility. Male infertility will be the low sperm count, oligospermia, low sperm motility, asthenozoospermia, abnormal sperm morphology, teratozoospemia, and the azoospermia, absence of sperm in the semen. Other indications like the genetic disorder to prevent the transmission of the inherited diseases, same-sex couples or the single-parent conception, fertility preservation, cancer patients undergoing the chemotherapy and the radiation. Types of ART. In vitro fertilization, most common ART procedure. Ovarian stimulation, egg retrieval, fertilization with sperm in egg. Embryo culture, embryo transfer into the uterus. Indications: tubal factor infertility, endometriosis, unexplained infertility, male factor infertility. Success rate is 30 to 40% per cycle, varies with age. Intracytoplasmic sperm injection. A single sperm is injected directly into the egg, embryo transfer. Indication: severe male infertility, low sperm count, motility or the morphology defects, failed fertilization with a conventional IVF. Intrauterine insemination. Washed sperm is directly injected into the uterus after the ovulation. Male infertility, unexplained infertility, cervical factor infertility. Success rate 10 to 20% per cycle. Gamete intrafallopian transform. Eggs and sperm are placed directly into the fallopian tube for the natural fertilization. This is due to unexplained infertility and the ovulation disorder. Zygote intrafallopian transform. Fertilized zygote, one cell embryo, is placed into the fallopian tube, similar to gift but ensures a fertilization before the transfer. Pre-implantation genetic testing, embryo biopsy to screen for the genetic disorder before implantation. For example, genetic diseases like thalassemia, cystic fibrosis, and the BRCA mutation. Cryopreservation, egg, sperm, and the embryo freezing. Whose eggs, sperm, or the embryos are frozen for the future use. For cancer patients, fertility preservation and the IVF cycle optimization. Oocyte donation and the surrogacy. Oocyte donation is used for the women with a premature ovarian failure or poor egg quality. For surrogacy, a gestational carrier carries the pregnancy for another individual or the couple. Complications of ART, multiple pregnancy, more common with IVF and IUI. Ovarian hyperstimulation syndrome. Due to the excessive response to the ovarian stimulation drugs, ectopic pregnancy increased risk with the ART procedure, but defects increased risk through the still rare. Psychological and the financial stress. ART can be costly and emotionally challenging. Success rate and the factors affecting the ART outcome. Age of women, best success is lesser than 35 years. Ovarian disorder is served by AMH levels and the antral follicle count. Sperm quality affects the fertilization and the embryo quality. Endometrial receptivity, important for the implantation success. IVF is the most common ART procedure involving the fertilization outside the body. ICSI is used in the severe male infertility where a single sperm is injected into egg. IUI involves a direct sperm injection into the uterus and is used as a mild male infertility. Gift and shift places the gametes or zygotes into the fallopian tube for the natural fertilization. Pre-implantation genetic testing screens the embryo for the genetic disorder before the implantation. Ovarian hyperstimulation syndrome is a complication of the ovarian stimulation in ART. Cryopreservation allows the freezing of eggs, sperm, and the embryos for the future use. Success rate of ART decline with increasing maternal age. Multiple pregnancy are the common risk of ART, especially IVF. Surrogacy is an option for the women unable to carry a pregnancy due to the medical condition.